Welcome to the office. Solenn, it's a pleasure to meet you.
Yes,
nice to meet you.
Nice to meet you.
And you're coming from where?
So I'm coming from Northern California.
Okay.
I'm originally from France.
Okay.
So
And you've been here, you're visiting mom, right?
Yes.
And you're here on holidays right now?
Yes, exactly.
Okay.
For 2 weeks.
You're here for 2 weeks?
Yes.
Okay. And you're going to be in LA here for how long with me? Depends on what we
yes,
find. Okay,
exactly.
fair enough. So what brings you here?
So I've been blocked in my hips for a long time. I was doing a lot of dance in the past.
What kind
mainly
of dance?
Ballet.
Ballet.
Ballerina.
Okay.
And
Since what age? 4, 3,
oh
2?
yes, yeah.
Since you're...
Always.
Okay, all right.
Yes. And
And is there a type of ballet you were doing?
classical.
Classical?
Ballet, yes.
Because I've
Mainly,
taken...
I was also doing contemporary and jazz, but
Oh.
mainly classical.
Mainly
ballet.
classical.
Yes.
Okay.
So yes, and
And you remember since you were a kid as a ballet, practicing ballet and performing ballet, that you've had issues with your hips?
yes, I can't remember when I was 3, 4, 5, 6, but I remember when I started to dance more, I started to have issue with my pelvis and pelvics and hips.
Okay.
Left
side, right side, both sides?
It's mainly in the middle, I can show you. But for example, when I'm laying on my belly, I can't bend my legs behind without lifting my hips, or I can't stand on my knees, or I can't stand up for a long time without moving, otherwise I have back pain.
Okay, and when you say back pain, where?
It's here, really in the bottom, like really.
Down here?
Yes.
Okay. Okay. So what she's describing is down in the lower sacrum coccyx area.
Yes. Okay, so the more I went, like I get advanced dancing, I went to a professional dance school, and I realized that there was something I couldn't do, and that was not because I was not flexible, because I'm pretty flexible, that's not an issue,
Okay.
but it's more that it becomes painful, and for example, I can't stand straight. I'm always blocked like that.
But aren't you taught to tuck in your pelvis a lot?
I was taught, but
because most ballet, they tell you
Yes.
to tuck your pelvis in.
Yes, but I couldn't do that compared to all the other dancers, and some teachers have seen that I have some abnormal issues in my hips.
Like what?
They didn't know, they just told me to see like chiropractor.
So
and
did you see a chiropractor?
it's called osteopath in France.
Okay.
So I went to see some. It's different, they don't do x-rays or things like that.
Okay.
I think it's like osteopathic doctor here.
Yes.
So that's what I went to see some osteopathic doctor
And
in
did they
France.
find anything?
They did some adjustment. I went to see one who saw that my hips were blocked in a way, I can't remember the name.
Okay. But there was no x-rays or no analysis in terms of...
No, not in France, never.
Understood, okay.
I don't know if there's a Gonstead Chiropractor in France. I'm
There's
not
a couple now.
Okay.
There is a couple now outside of France.
Okay.
And there's one that I went to go see. He's about an hour outside of Paris.
Okay.
So there's somebody there we can talk to. Okay?
Okay.
For the future. You're moving back to France eventually?
Perhaps, I don't know yet.
Who knows? Okay.
Yes.
See where life takes you.
Yes.
Right? Because you're in university right
Yes.
now. Okay, so enjoy your journey. Let's figure out what we're going to do here for you and figure out what the actual issue is.
Okay.
Okay, so, and I want to be clear about the terminology because
Yes.
the way you're describing may be different than the way I
Yes.
describe it.
I know.
Right? So when she's saying you're blocked in the pelvis,
I don't know if it's a pelvic, so.
she's referring to her foundation, not just the sides.
Yes,
So,
exactly.
you know, when you're saying pelvis, and I'm going to grab the spine model, just so that we're clear and that, you know, people watching, they're also clear about what we're talking about. So typically when we're talking about the pelvis, we're talking about these bones here on the side. But you're talking about your whole foundation.
Yes.
Right?
Yes.
And we're talking about what you're describing is down here low in the
Yes.
sacrum coccyx.
Yes.
Okay.
I always had pain, very like in the middle.
Since you can remember.
For a long time, yes.
Mom, do you remember anything growing up? Any major slips, falls, trauma she had in the past?
I said we had a car accident when I was 5.
Yes, but it was not a big accident, and I didn't think she had something. But
How old? But how old?
She was about 4,
5.
4 or 5.
Yes.
And before that, she was doing ballet before that.
It's like
Yes,
baby
yes.
ballet.
Okay,
so
no,
you
I know
can't
it's okay. I get it.
Yes, but she was doing ballet.
She was
Yes.
doing ballet before
Yeah.
that. Okay, and all right. I'm just trying to put some pieces together. Okay. All right.
I also have very short Achilles tendons, like very, very short. They wasn't like that when I was a little child, but now they are really...
Meaning they're tight?
Yes, very tight. I can't bend a lot
Okay.
around here, and like I can't...
Show me.
I can't really... You see, if I do that, I fall. I
Okay.
can't stay here. It's
Hold my
very
hand,
short.
please. Stand up.
Yes.
Hold my hand. And go ahead and bend down. So they're very tight, but the question is, are they actually tight?
Yes.
Or is it ankle issues, talus? And I'm going to be
Yes.
explaining that, okay?
Okay.
Over here and have a seat. Okay, so we have foundation, something in the foundation. We have tight Achilles both sides.
Yes.
What else?
And now I have many health issues, like for 4 years I'm constantly bloated.
Okay.
I tried many things, like diet things, but no matter what I eat, even if I eat good or bad things, I'm always bloated.
Okay.
It's like stuck, and I have also, sometimes my feet becomes completely purple, red purple if I stand for a long time.
Okay.
My feet become very purple. I don't know if it's related to my hips. I don't say that, I just don't know.
So when did the legs or the feet or the legs? Where does it?
I would say it goes up here, but it's mainly
The
toes?
toes?
And yes, the feet.
Okay. And you've been to the doctor for any of this?
Yes.
Did
but
they find anything?
No.
Is this all back in France or here as well?
It was in France too.
All in France.
Yes.
And here they did any blood work? They didn't.
Yes, but they don't find
Nothing. Okay.
Yes.
Do you have that blood work by any chance? Can you get it for me?
Yes, I have it on my phone.
Okay. Can you email it to the office?
Yes,
I want to
sure.
look at it, and
Sure.
I look at it a little bit different.
Yes.
I do functional medicine as well.
Okay.
And I look at blood work. I look at if there's any excesses or imbalances in the blood chemistry.
Okay.
And that, yeah, so just send it to me and I'll take a look
Okay.
at it, okay?
Okay.
All right, so the bluing or the purple or blue?
Red, purple.
Red,
it's not
purple.
Blue. Perhaps in the winter when I'm cold, but
Temperature changes, like does it get hot and cold regardless of the temperature outside?
my feet are often cold,
Okay.
but they can be red even if my feet are warm, so I don't...
So there's no temperature changes associated with it?
I don't think so.
Okay. All right. Okay.
Yeah.
What else?
I gained a lot of weight recently, very fast. I
In
don't
how
really
long?
know why. It started...
How much? How much?
Oh, probably 30 pounds in pounds.
In the last year?
Perhaps 25, yes, in the last
In
years.
6 months, even.
Yeah, in
3 months.
3 months. It was crazy, and it was even painful. At night it was painful.
Where? Mainly in your
the
legs?
thighs and the hips.
Okay, and I want to talk about that before we continue.
Yes.
Someone who gains weight very fast, I see what I see already, okay?
Yes.
That you're gaining a lot of inflammation, and there's a
Yes.
big misconception when people gain weight fast. When they gain weight fat, like people don't make fat that fast. It doesn't
Yes,
happen in the body.
Okay.
It's inflammation. And prior to this year, did you have any fluctuations in your weight up and down? Like she would gain weight 10, 15 pounds and then lose 5, 10 pounds?
In the past years, yes, perhaps I gained 10 pounds, lose 10 pounds. It started to be less stable, but in the past I was always very stable. When I was
Up until how many years ago?
2 years ago, 3 years ago.
So 2 years ago is when you
Yes.
started to really feel it.
Yes,
And if you don't mind me asking your age?
I'm 22.
22. And the reason I'm asking it because there's a lot of other
Yeah.
people out there, and I've taken care of quite a few ballet dancers in the
Yes.
past of different ages.
Yes.
You know, and I'm sure you've watched those videos.
Yes.
Okay, I'm sure. And they've been very different cases,
Yes.
causing different issues.
Yes.
And I think the first main thing is, and we know, is the foundation. We need to figure that part out. Number one. Number two is the digestion, right? The
Yes.
digestion and the inflammation.
Yes.
Where is this coming from? And then, did they do blood work or anything to rule out any other conditions?
Yes, we did a thyroid issue,
Okay.
but everything was normal. I did a hormonal test and I didn't have any progesterone, so that was
Low progesterone?
Yes, so that was one of like perhaps weight gain. So I don't know. That's just one.
Okay, so low progesterone was
Yes.
one thing.
Yes.
Thyroid was within normal limits.
Yes.
All your other hormones were within limits?
Yes.
Or they just did progesterone?
They did estrogen and progesterone,
Yeah.
but progesterone was too low.
So that's kind of interesting. You know why? Because when you look at the hormone biosynthesis of our hormones, all our hormones come from progesterone.
Okay.
Okay, all of them, and that comes from pregnenolone. And I mean, let's rewind. All the hormones, estrogen, testosterone, comes from progesterone,
Yes.
and that is precursed all by cholesterol.
Yes.
And so I would be very interested to see the cholesterol, the lipid profile, number one.
Okay.
Number two is, even if whatever was within normal limits, let's take a look at it and look a little deeper with it.
Okay.
And the blood test was in the past year?
The thyroid test, not the hormonal test. It was a year ago.
And the thyroid test?
It was last month.
Perfect. Okay, can I still have that information, all of
Yes.
it, please?
Yes.
So we'll take a look at it. Okay. All right, so we have a few things to figure out, don't we?
Yes.
Anything else?
No, I have a puffy face too.
This is all inflammation,
Yes,
okay? And
very
this
puffy face in the morning, especially. And
is discolored? Does it get red a lot?
no, not
No, right?
really. And I can't stand up for a long time. That seems
Fall?
No, I can't stand up, I can't stand for a long time, otherwise it's painful in my...
In your foundation?
Yes.
Okay.
I don't know.
Anything else, Mom, you want to add?
J'aimerais que tu montres la position.
She want me to show you how,
Please,
okay.
show me.
So the first
Let me just
thing
move this over, okay?
is that
Let's move this over, and let's move.
I
Why don't
can't-
you come here in the center?
I can't stand up like I'm like that. I can't listen.
So what she's saying is she's in anterior, you can come on anterior pelvic tilt. If I try to bring this back, the sacrum doesn't go back, and I can feel the inflammation and swelling there.
Yes.
Okay, so that's number one. She's in,
Yes.
she's in anterior pelvic tilt. She can't come back.
Yeah.
Okay, what else?
I don't know, that's the same, but I can't bend my knees behind without like lifting my pelvis.
Let me do it. Straighten it out. Straight. Let me just bend the knee myself. You mind if I open?
Yes.
You know, let's turn to the other side. Let's turn, put your head over here on this side, please. So if we're looking here, she's in anterior pelvic tilt. We're going to, as soon as we bend, we can see the hips go up. If we do both, but there's no pain, right?
It's not painful now.
Okay.
It's uncomfortable if I stay for a long time.
That's where I'm finding it, right there. It's right there. You feel that?
Yes.
So I'm going to be on the segments here, okay? I'm just on the underwear there, okay? Now watch, if I push, it's tender, right?
Yes.
This is S5. Bend your knees. Down. That's the one I'm finding. Bend the knees. You see the difference?
Yes.
It's a coccyx injury. Okay, go on to your back, please. Bend the knee. Pain in the low back.
No.
Bend the knee. More flexible on this. Bend the knee. Pain in the low back or discomfort?
Discomfort.
In the hip or the back?
Hip right now.
In this hip.
Yes.
Bend. Discomfort in the hip?
No.
Okay. Sit up for me, please. Turn. Okay. We're going to go over your x-rays.
Okay.
I'm going to explain what I see first.
Okay.
I had a little sneak peek before. That's why I was asking certain questions, okay?
Okay.
Once we go over your x-rays, we'll
Okay.
examine you and figure out where we're going to start.
Okay.
And hopefully we're going to get some sort of result within 1 or 2 adjustments.
Okay.
I don't know if I'm going to fix it all in 1 or 2 adjustments, but we're going to get some sort of result.
Okay.
Okay?
Yes.
You ready?
Yes.
Let's get started. Come on. All right, Solenn, this is you. This is a picture in time. This is your full spine x-ray. This is looking you from the right, from behind. This is the right side. Okay? We have 24 bones in the spine that move, 23 discs in between. This is your 24-story building. This is the foundation of your 24-story building. This is your side profile. Looking at your side profile, we're looking at a few things. I would like to go over this one first, okay? Then we'll come over here. And a lot of our answer actually is in this x-ray, a lot of it. Now, when we're looking at this x-ray, three main things we're looking at first. Number one, curvature. Do we have the right curves in our spine? Our posture and the discs. So actually, let's go over the posture first. And this is our posture line, okay? We run the posture line through, and this is representing the hips. The lowest lumbar should go through the neck here and the top of the neck here, or the shoulder and the ear. And the first thing it shows us is she carries her upper body behind the foundation. So I know you also get a lot of tightness and pain across your shoulders when you're sitting or standing, not just in your low back. Okay, so that's the other thing. So posture-wise, we need to see what can we do to bring this forward, not just work on the hip. Looking at the curvature, I'm going to move this out. Actually, I'm going to get rid of this now for just right now. When we're looking at the curve, this curve is good. Okay, let me zoom in. So your L5 disc is perfect. Level, parallel. It starts to tilt here though, these two, right at 4. It tilts back, but there's a little circle there. Little circle there. That's a little bit of the lateral bending on the other x-ray, which we'll go over. So what happens is this is level, this one goes back, this one goes back, this one goes back, and they all start to stair step backwards. Do you see what I'm showing you? And I'm just going to change a little bit so we can see here. So the sway back is starting about here, 5, 4, 3, number 2. Number 1 goes back more, 12 goes back, 11 starts to level off here. It should curve like this, but now it should start curving forward. But you're in this position, you're stuck back here. And part of that may be due to the pelvis not moving correctly. Okay, there's a possibility. Now, let's continue up. As we go up, these discs are all good. Some are wearing out a little more because of the imbalance. This one is wearing out a little bit faster. This is number 2, 3, 4, 5, 6, 7, 1, 2, 3, 4. Number 5. And T5, T6, this is liver gallbladder. Digestion. Okay, and for whatever reason, this one is wearing out a little faster. When we look at your neck, Mom, you following me? Okay, good. When we look at the neck, we don't have the right curvature in the neck. Okay, the discs are still decent. They're still, this is good, good, good. This one starts to wear out a little bit more, and what I'm trying to figure out, I can see these facet joints. These joints here are for guidance. They guide the bone, this joint here, right? I can see this one good, this one, and then all of a sudden this one disappears somewhere. You see what I'm showing you?
Yes.
And then these are good up here. Okay, now let's get to the actual, what we're waiting for. There's her tailbone injury. This is a coccyx case. I'm gonna change the contrast a little bit so you can see. So you see this piece here?
Yes.
This is the very tip of the coccyx. And what's interesting in her case, this was an injury, I will say this. And what kind of injury, I don't have that answer yet. When we're looking at the sacrum, okay, it's 5 pieces. And they become one bone, the sacrum, after about age 30, 31, 32. Depends on the books that you read. So we still have something to work with. That's the good news.
Okay.
Okay? When we look at the coccyx, the tailbone, that's this. So we have, here, let's look at it this way. 1, 2, 3, 4, 5 pieces that form one bone. And you can see on the inside we have nerves there, right? 5 sets of nerves.
Yes.
We have the nerves. So those nerves can cause pressure and can cause the issues that you're experiencing. Okay? Follow me. Now, the coccyx, that's what's interesting in her case. Let's look at it this way. The coccyx, this is the coccyx bone here. This piece, typically when it misaligns, it goes forward.
Okay.
Yours, one part has gone forward, one part has gone backwards.
Okay.
And there's a shift. This piece here, it's a little hard to see. I'm probably going to take another x-ray in a day or so.
Okay.
Okay, but this piece here, right here, is off-centered on this piece. This is forward, this is back. So you had probably two tailbone injuries.
Okay.
And it didn't have to be something when you're young, right? We slip, we fall, we get up, we get on with it, okay? And most of the time, I know I have 2 daughters, and they're very, very active, okay? And they slip, they fall, they get right back up. And it's not unless we see something off that, life goes on and the body starts to compensate, Mom. So it's not your fault, okay? I don't want you to, I have parents that get guilty about it. Please don't. No, seriously, because it's like, well, maybe she had some falls and we didn't know about it, and that's very typical. But this is what I see doesn't look right to me, the coccyx. S1 is also an issue here, S3. Okay, we have tailbone stuff to work on here. Now, there was a case, I don't know that that's your case. One of the cases we have a video on where she had a coccyx issue. There was a dancer, and she had this hip pain.
Yes.
And we adjusted the coccyx and the hip pain was gone. And it was the first time I had a case like that, where it was a coccyx causing the actual stuff. Okay, and so we've seen a lot since. I see a callus forming here. I see little calluses. You see how this is smooth?
Yes, and this.
There's a callus there, there's a callus there. To me, that's the way I see it. And there's a lot of people that wouldn't see it that way or agree the way I see it, okay? And that's okay. I'm all right with that. Now, these are good. These are good. These are good. These are good. You follow me?
Yes.
Okay. 5 is an issue. You had an injury there. That could be part of what happened with your tailbone. Okay. Let's continue on. Let's look at the foundation on this angle. So we can see now here's what's getting me, okay? When we look here, this foundation is pretty balanced. There's her hips are level. There's no misalignment of her pelvis.
I had so many adjustments from osteopathic doctor in France on my hips, so I don't know.
Maybe, well, whatever it is, they did a good job. The good news is your pelvis is balanced. So that's not the issue.
Okay.
Now, if we zoom in, there's a little bit of fusion there. Right? This is fine. So there's all this gas.
Yes, that's what I was going to ask.
That's gas.
Okay.
And the answer is we don't have a Megan-Blasi here. And the Megan-Blasi is the gastric air bubble. This hole right here should be this dark. This is the gastric air bubble, the Megan-Blasi it's called. It should be this big. Okay. So yours is about 1/3 the size. The shape is correct, but it's not dark.
What is it?
The Megan-Blasi, it's an air bubble in the stomach. It should be there.
Oh, okay.
Yours is smaller and is gray compared to the gas here, you see? And then this is all undigested food. It's inflammation in your body. It's a lot of inflammation. Now, whatever this is, it starts here at the low back and curves. So your pelvis is right, but the rest of it ain't right. Okay? That's the idea. And I'm just very curious as to what work you had done there, but that's okay. This is a digestion and a foundation case, okay? That's what I see here. Let's go ahead and get started. There's a deviated septum as well. You have any breathing issues?
Sometimes in the night, it's like I feel like it's swollen. I don't know if it's...
On the right side more than the left side?
Yes.
Yes, okay. So if you want me to deal with that later, I'll deal with it as well, okay?
Yes.
You ready to get started?
Yes.
Yeah, let's get started. Okay. So I'm just feeling her skin, okay? And just feeling it. There's an adrenal issue. Has she had her adrenals checked?
No.
Okay. Have you been taking cortisone shots in the past?
No.
No cortisone?
No. Never.
This is going to be an interesting case. So what she feels like to me is someone who's been taking cortisone. I know they're looking at me going, what are you talking? That's what her skin feels like to me. And I felt enough.
I feel as puffy as someone who takes cortisone.
Let's start. Starting at the base of the neck.
No.
So the first thing I'm getting is 20 points up top, occiput, atlas, right side. There it is, right there. And it stays on the right. It lessens, but it stays on the right the whole way down. This is cord pressure first. And then it switches down low. Now, classic cord pressure is usually down at over at C1, goes down and switches around S1. Hers stays on the right side all the way down, and then it goes down at S5 coccyx. So the first two things right off the bat we're getting is S5 coccyx and up in the right side here. Those are the two things. Up top in the basement and the penthouse. Okay? Next thing we're going to do is static palpation. So next thing we want to do is static palpation. And I'm running my fingers down the spine, and what I want you guys to see just by this, you can see this is all inflammation, okay? All this is inflammation. This is not fat. Inflammation. That's what we got to figure out. Now you can see as I'm running it, this is all inflammation. I don't really see the spine. Yeah, on the left side. So she's more swollen on this left side. It's more firm on the right, all the way down. Okay? And as I'm doing that, it's very red. And we call that the hyperemic response. Sit up straight. Now I know you're more in this anterior pelvic tilt, so it's okay. Now you're sitting back like that. Why? Because if you're like this, why are you sitting like this?
I don't know, it feels more comfortable.
Sorry?
I don't know, it feels more comfortable.
What feels most comfortable right now? This way?
If I sit straight, I need to be here.
Okay, got it. Come back. Can you do that one more time? I want to show these guys something. Do that again. Sit forward. So the first thing you can see, the creases are different. This is higher, this is lower. This is all inflammation. Now, from here, I'm going to bring this down. Look, that's all swelling from her tailbone. Okay, sit back for me, please. I know I'm overemphasizing it for a reason. I'm going to be on your underwear, ma'am, okay?
That's okay.
Okay. Now, feet together. Open and close your knees. Are your feet touching? Feet together. Open and close your knees, feet touching.
Oh,
Don't-
okay, sorry.
Yeah, open and close. Open and close. Right side only. Good. Right side. Good. Left side. So when she does the left, there's more fixation on the right side. Do the right side, please, only. Left is just, there's just swelling, inflammation. You don't really feel that as much. Fixation is on the right SI joint. 2. Come back slowly towards me. In extension, and you're going to come back this way. Are you okay doing that?
Yes.
Okay. This is L5, S1, S2, pain,
It's not painful, but
S3, pain,
it's more uncomfortable. I don't know if it's really pain.
S4,
Yeah, it's pain.
pain. Okay, S5, come back,
Yeah.
pain. Now, come back.
Yeah, it's pain.
So, when I get to S4, tender, S5, and then that's coccyx.
Yes.
Yes?
Yeah.
Okay, this is coccyx. Sit back for me, please, a little bit. There. Good. Left side, right side. That's C1 on the left. That's occiput on the right. Atlas occiput. Let's keep the shoulders there. And I'm just going to nod the head forward, okay? Just like that. Regular nodding, right side. Doesn't move. Left side moves. Left atlas, right occiput, S4, coccyx. That's all. Stand up, please. Stand over here, right over here. Turn around. And we're going to have you walk, okay?
Okay.
And I want you to walk to the end of the room and back a couple of times, please. Just regular walking. Just keep walking. Now, the first thing I notice, and I understand with ballet, has she always walked with her feet out since she was a kid?
No, not as much, I think.
When
I
did
don't
it's so I'm noticing that you're walking with your feet out.
Yeah.
Okay, and that's not from ballet though.
Okay.
No, I'm asking, is that from ballet?
I don't know.
Do they teach you to do that?
Not to walk like that, but we always like that in ballet.
Correct,
so I
okay.
don't know if
I mean, the other dancers that I've taken care of, there's a little bit, but
Yeah.
yours is a little bit more. And when I see that, okay, bilateral toe out, we call it the duck walk,
yes.
right? That's usually an upper cervical up top.
Yes.
And that's the reason I'm asking, were you doing this as a kid? Do you remember her walking like that as a kid? Because it's helping us determine what came first.
Yes, I think
Okay.
So I'm thinking you had...
began ballet to very young.
Got it, okay. So it's possible there was a connection there. Walk on your toes, please. Turn
And
around.
toes, like that.
Yes. And there's no movement in her hips. She wiggles side to side. The French wiggle, sorry. Turn around, walk on your heels. This is the hard part. Okay, this is a good test for us. Good test for us. Okay. Come back over here. Have a seat. So let's formulate a game plan now. And we're going to work on your feet. We're going to work on all that stuff. That's not my focus today, though.
Okay.
This is not, I'm going to just crack a bunch of stuff. That's not what we're doing here. What we're going to figure out today, we have the coccyx. We need to set that today.
Okay.
I'm going to set your coccyx. I'm going to have you walk. I'm going to then rescope her. We're probably going to work on the upper cervical as well. Now, here's the interesting part of the case. This is a parasympathetic issue, digestion. Parasympathetic nervous system, upper cervical and down low. So we're going to stay in that system with you. Okay? Don't be surprised. Good or bad, I don't know. It's not a good or bad, it's just what's going to be different. If you start going to the bathroom a lot, it's a good thing.
Okay.
Okay, because you got to get it out somehow.
Yes. Okay.
Right? Okay. Now, let me just look at the x-ray one more time and figure out how we're going to set this. You're going to make me work here, yo. Good. That's good. All right. C2 left. C1 left. Yeah, it's compensating. Okay, I'm probably going to take a re-x-ray. I'll need to take a re-x-ray. This is all compensation. I'm going to adjust her today, probably see her in the morning, and then take a re-x-ray for the afternoon. You ready?
Yes, I am.
Yeah, come on. Let's go over here. All right. The Coccyx. Let's go right side down. You're going to go right side down, lay on your right side, please. Now, the thing I need you to focus on, Solenn, this ankle stays behind the knee.
Okay.
Okay? I'm going to be down low here. We're going to set it forward, okay? Try not to let that move over there, please. There we go. There it is. Let it roll. That's the home run. The Coccyx. Come on up. Go ahead and walk now. Keep walking. As you're walking, tell me if anything feels a little different.
I feel better here, like more space. I don't know how to.
Interesting. Let me fix your shorts. Go ahead and walk. Just keep walking. 10,000 steps a day is the homework, okay? Lots and lots and lots of walking.
Okay.
And I know you like to walk. Good. Keep going. Come back over here now and have a seat. Let's rescope everything. Good one. So already from that, feels different. Tell mom.
Yeah.
Feels different. Let's go ahead and rescope. And that went from 20, 25 points down to 10, but it's still there up top. And now there's no cord pressure. Interesting. That's crazy. In a good way. Okay. I want you to feel this before I continue, okay? Come back.
Yeah, it's less painful. It's not really painful.
S4. Pain.
No. Yeah.
Uncross your arms, Mom. Please. No, please. It's an energy thing. I talk about it in a lot of my videos. Please. Okay. Don't sit back yet. Let me figure out this upper cervical. All right. So this has been compensating long time. Her right atlas. There's a little bit of calcification on the very tip. It looks like a little beak, we call it. And that tells me it's been there for a long time. So I have a feeling, like I said, something happened a long time ago. You feel this?
Oof, yes.
Yeah. You feel that one?
Not that much, no.
Bend to the right
Oh,
there.
yeah.
Okay. We're going to start on C2. C2. Bring that back there. Good. There it is.
Oh.
Okay? Stand up and walk it off, please. One more time. As you're walking, tell me what's different, if anything, overall.
I don't know, I really feel more open, less tight around here.
Okay.
And I feel more straight.
More stable?
Yes.
More stable,
Yeah.
right?
Yeah.
Back over here, have a seat. Let's rescope. I think that's where we're going to start. And you're going to enjoy your walk. Voila. 0. That's awesome. Now, it was a little crunchier than I like it, but that was your first adjustment. They're going to set deeper each time.
Okay.
Okay? That's it. That's awesome. Awesome. Come back slowly. Come back. Different?
Yeah, it's way better.
Good. Voila. Okay. Awesome.